Good morning and welcome to TUC's Congress Fringe on social care. We've got a really exciting hour planned for you with an absolutely brilliant lineup of panelists. What I'm just going to do for the moment is just let more of you join the call. So bear with us and we'll be beginning in 1 minute or so. So just to repeat again, good morning. Thank you to all of those joining us. We are recording this session and we'll be beginning in just 1 minute or so. We'll just give people a little time to join the call. We know these things sometimes take a minute or two. We'll be beginning in about 30 seconds. Okay, good morning, everybody. I'm Sian Elliott. I'm the Senior Policy Officer in the Public Services team at the TUC. Today is our 152nd TUC Congress. This year we're entirely virtual, so some of you are joining us via our webinar link and some live streaming on the TUC website. Welcome to all of you and welcome to our amazing lineup of panelists. We're really looking forward to getting into some of the really meaty issues around social care with you over the next hour. It's a really timely event given the announcements this week in the UK, but also what we've seen throughout the pandemic, where the essentialness of the work that care workers do has been brought to the fore. We'll be recording this for future possible use, and so please do use the chat function to introduce yourselves, and any questions that you may have for the panel, please use the Q&A function. That's where we need you to put in any questions that you may have for our panelists, and I will pick those up as we go along. We have a code of conduct for TUC online events, and my colleague Jay will shortly post that into the chat. We also have today our brilliant BSL interpreters, Liz and Hayley. Thank you so much, Liz and Hayley, for joining us this morning. And thank you too to our speech to text captioner, Debbie, for making this an accessible online event for everybody that wants to join us today. As I said, we have a really fantastic panel with us this morning. I'll quickly go around and introduce who we have in front of you. So we have Christina McInerney, General Secretary of Unison, who organise and represent members working in social care, as well as across health, public services and the private sector. We're also joined by Mary Ann Stevenson, Director of the Women's Budget Group, a network of academics and policy experts whose aims are to promote a gender equal economy through in-depth analysis of policy and its impact on women and women with different characteristics and identities. During the pandemic, Women's Budget Group have led the call for a care-led recovery, following hot on the heels of their vision-setting Commission on a Gender Equal Economy. Then we're joined by Phil Hope, former Minister for Care Services and co-chair of the Future for Social Care Coalition. The FSCC are a coalition of cross-party politicians and cross-sector social care representative bodies, including trade unionists, who are coming together to put forward recommendations for a complete overhaul of the sector, and with the hope of bringing it on par with what we see in health in the NHS. We're also joined by Julia Solo, who's lead organiser with the NY Caring Majority, a New York statewide based campaign led by and for older adults, disabled people, their caregivers and families, all campaigning together to create good quality jobs in care with a fair wage for care workers. And can I just say, Julia is joining us. It's 6:45 a.m. in the morning over in New York. So a very big thank you, Julia. We really appreciate you being here. And last but by no means least, my colleague Nisreen Mansour, Policy Officer at Wales TUC, joining us live from Cardiff. Nisreen helps lead on our work on the economy, social care reform and the Fair Work agenda in Wales. Is going to be telling us this morning about some of the brilliant work going on there with the Social Care Forum, a tripartite system to improve social care for all of those living and working in Wales. We were due to be joined this morning by two others, Chika Rubin, a GMB activist, a health and safety workplace rep and a care worker, and Gemma Collender, organiser and care recipient with the NY Caring Majority. Unfortunately, neither of these women were able to join us this morning in the end, but it's really important we recognise that they wanted to be here. And it's so important that we have the voice of care workers and of those receiving care when we have these discussions, particularly when they reflect the really diverse makeup of those who are working in the care workforce and those adults receiving care. The structure for this morning's event is a conversation. What do some of our panellists make this week of the announcements that we've seen by the UK government? What can we learn from those brilliant organising going on in New York, and how are other governments, namely Wales, but also internationally, addressing reforms of social care differently to what we're doing here, and what can we learn and bring back to our own system? As I said at the start, the social care system is a vital part of our economic infrastructure. We have seen throughout the pandemic the tragic cost of neglecting it. In the UK, the sector has long been a marker for all that is wrong with the current approach to delivering public services. Decades of government inaction, chronic lack of investment and underfunding, privatisation and deregulation have all led to a broken system of care. Across the world, we see that reflected in the widespread undervaluing of the role that social care plays in the economy, and that the value of those that are in the workforce deliver to it. The case for reforming our care infrastructure is irrefutable. Social care is one of the most important sectors in our economic and social infrastructure, contributing at least £46.2 million to the economy, as estimated by Women's Budget Group. And it represents 6% of the total UK employment, with that expected to grow rapidly in the coming decades. Because we're seeing an ageing population and a surge in care needs stemming from the pandemic, it really is an area where there's huge, good quality jobs growth potential. In the UK, estimates suggest that the sector will need to recruit 5,200,000 extra jobs nationally by 2035 to keep up with the ageing population. We need high quality care and high quality employment for those who are delivering it. And last week, the TUC set out plans for a new sectoral minimum wage of at least £10 per hour in care, for a pathway towards collective sectoral bargaining, and a way for government to pay for it. We proposed fully costed out reforms to capital gains tax that would generate up to £17 billion and would mean that those with the broadest shoulders are helping to fairly pay their way and helping us deliver the reforms we need in care. Instead, on Tuesday, the government chose to take a different approach to funding the reforms needed, raising national insurance contributions and some tax on dividends, estimated to raise around £13 billion a year. And I think that's a really good place for us to start. So, Mary-Anne, I thought we could come to you. Could you give us an overview of some of the announcements we've seen made by the UK government this week and your reflections on what that means going forward?
Yes, of course. Morning, everybody. It's lovely to see the panel and to be here. The first thing to say about the government's announcements this week was that they were starting in the wrong place. So from the Women's Budget Group, and I imagine many of the other panelists here, that the key question can be, how can we introduce a system that allows people to live with dignity and autonomy and safety? And that means, how can we ensure people have the care that they need and that the people working in the care sector are properly paid? The government's priority, as set out in the manifesto in 2019, was ensuring that people didn't have to sell their homes to pay for care. So they have introduced what's called a cap and floor model, which means that The costs of care are capped at £86,000. That is only for residential care. That is only the personal care element. It isn't the hotel costs. So it isn't the accommodation and food costs, which people will still have to pay. And the amount of assets you can have before you have to pay anything at all has gone up to £20,000, and between £20,000 and £100,000, there's a sliding scale. There's a number of problems with this. First of all, it's still meaning that people are accessing care on the basis of ability to pay rather than need, because it's not doing anything about the way in which people are assessed as eligible for care. And we know that there's large numbers of people eligible for care who should be getting care who are not. But secondly, the increase in national insurance contributions won't raise enough money to pay for what's needed. So the government's talking about raising about £36 billion over the next 3 years, of which £5.4 billion will go into social care. And that's less than £2 billion a year. That falls way short of the money needed to provide care for those who need it. And a lot of that money is going to be going into the cap and floor model. So it's about protecting the assets of people who've got, who want to leave inheritances for their children or grandchildren. So what we said is, A, this is the wrong starting point, and B, you need to raise more money and in other ways from national insurance contributions, because the problem with national insurance contributions is they're only imposed on income from earnings, not income from other sources. For example, if you are a buy-to-let landlord, receiving their income in the form of rent wouldn't pay any of this additional NIC contribution. There's far fairer ways to do that, but I've talked for long enough, so we can probably get into more detail about that later.
That's a really useful starting point. Thank you, Marianne. And Christina, I wonder if we can come to you, because Unison represents care workers. And we know exactly as Marianne says, this is not the right starting place. What is it that members are telling you they want to see in terms of change delivered on social care?
So thanks, Shan, and thanks, Marianne. So in terms of what came out this week, it went nowhere close to what people were expecting. It was absolutely smoke and mirrors as far as we could tell. And what people want is an actual plan. They want a workforce plan as well. You want something that's sustainable going forward into the future, something that actually addresses the fundamental structural problems that we've got with the care sector at the moment, which is it's hugely fragmented. And there is no consistency across it in terms of standards of care. I mean, there is a kind of loose standard of care that's not quite enforced, but there is something like that. But they want consistency, they want better standards of care, and the critical one, and I'm a co-chair of the Future Social Care Coalition with Phil, and what we've been calling for is a proper workforce strategy, and that you can build out from a workforce strategy once you actually see what is it you need in care, and to deliver that, what's the workforce that you would actually need.
Thank you, Christina. And on that workforce strategy, Phil, if I come to you, as Christina says, the other co-chair of the Future for Social Care Coalition, I know that you've been working on a people's plan for social care, and I wondered if you could tell us a bit more about what that looks like.
Yeah, thanks, and thank you again for inviting me to join the session this afternoon. Christina and I have been working with a cross-party. We have Conservative MPs, Liberal Democrat MPs and others involved, cross-sector, employers, employees, of course, representatives, but also the people who use care and support are represented and take part in that coalition. So it really is a very large group of people across all organisations who are absolutely clear that the care workers, and not just care workers, personal assistants and indeed unpaid carers too, when we think about how the care system operates, deserve a much better deal if we're going to improve the care that people receive either in their own homes or in residential care. And that cross-party consensus has very clearly talked about increasing the pay that care workers get from the minimum wage to at least the living wage in the first instance, and then ideally to have parity with NHS staff, to have parity with healthcare assistants band 3, and that would put the hourly rate up significantly for care workers. But also to improve the conditions of work and to have a career structure. The NHS has something called the People Plan, and it's a whole plan for the way that the staff of the NHS at every level, in every type of delivery, are rewarded, are supported, have career opportunities and so on. And what we called for is the equivalent. Let's have a social care people plan that provides a similar experience where people's pay is right, their conditions are better, and they have those opportunities to move and to develop their careers within the care sector. And at the moment, of course, this, as Mary Ann was describing earlier, this national insurance contribution is absolute, as a way of raising the money, is actually punishing care workers. Care workers are going to have a pay cut. They're going to be paying 1.25% national insurance that they weren't paying before. That means they get less money, not more, at a time when they've gone through the pandemic, when they've provided the heroic support for people in the most terrible conditions and have suffered themselves, many have died. They're now going to have a pay cut. And not only them, the employers, the care providers, if they're not public sector care providers, they don't get their national insurance back. So the care providers have got less money to pay the workers and to provide the care that the system needs. This isn't a care levy. This is the opposite. This is a punishing the care system and the care workers within it by taking money away from them to so-called give it back. And then the 12 billion that Mary Ann talks about per year, well, 10.2 billion of that, as she said, goes to the NHS. It's not a care levy. This is an NHS levy, taking money out of care workers' pockets, out of care providers' funds to deliver care, and giving it to the NHS. And by the way, the 1.8 billion, as we know, as Mary Ann has said, half of that is to pay for the cost of the care cap, which is the money that provides free care for people who've got loads of cash and loads of assets. So it really is taking from the poorest people and giving it to the richest. And so you're left with about 0.9 billion, I think, is the figure per year that this 13 or 12 billion a year care levy is supposed to raise for the care system. Well, it doesn't. It raises it for the NHS. It does. The care system is going to be struggling at the moment. We know there are 1.8 billion worth of pressures in the system as we sit here today. This is going to give the system 0.9 billion, half of what is needed just to stand still. I'm afraid the way they've raised the money is just shockingly bad in terms of fairness. And secondly, they're not even raising it for the care system. They're raising it for the health system. The health system needs more money, but don't take the care system's money to give to the health. It should be the other way around.
And I think it really, some of the discussion on this overlooks how interconnected social care and our health system are, and that by delaying the money that can go to social care, you're only going to be exacerbating the pressures on our NHS because of that huge unmet care need. It's estimated 1.7 million adults have unmet care needs, and what ends up happening is that is piled into the NHS in blocking beds in other ways. But we know that by not funding social care, you're going to be hamstringing the NHS too as it tries to recover from this pandemic. Julia, I wonder if I can bring you in here, because as Phil was saying there, this is what's happening in the UK at the moment represents actually a pay cut for our social care workforce. 7 out of 10 care workers, according to the TUC's analysis, earn less than £10 an hour. And I know that making sure care workers in the state of New York are paid a proper living wage is key to your campaign. I wonder if you want to share your video with us and then give us some of your thoughts on the work that you're doing in New York.
Absolutely. Thank you so much for including us. Yeah, I feel like the best way for me to express what we're about at the New York Caring Majority is to show you this short film that we created with our leaders during the height of like the early pandemic, which really illustrates the struggle that both the people who need care and care workers are going through. And so I'm gonna share that, and then I'll talk a little bit.
Hello? I have no idea what I would do without my home care worker. I feel that they deserve more money because the pay is little and he does so much.
Benefits are basically non-existent unless I want to spend basically my whole paycheck. If I did that, I wouldn't be able to live.
And it feels very unfair that people who work with me are paid poorly by the state, because I would never dream of paying them as badly.
I have been in home care for the past 16 years, but my pay hasn't increased at all.
I am so demoralized by Governor Cuomo's attack on home care funding. It feels like he's trying to, I don't know, wring water from a stone.
Home care is essential, especially being able to trust the person that comes into your home instead of going to a nursing home.
I go from rage to despair, always worrying that I'm going to be forced into an institution so many years after social workers fought for me to live outside in society.
I don't think Governor Cuomo would go into a nursing home now if he had to, or he would send his mother there if she needed it. Nobody wants to.
We have seen the way you protect and nurture the most at risk in the midst of this pandemic. How you rise to make sure elders and people with disabilities are cared for.
It's important for me to have some sort of sense of independence, that I can live in my own home and direct my own household and be in the community as opposed to being locked up in a facility.
And they say to us, if you had your flu shot, you don't need a mask. They care about us covering the shift, but they don't care about our health.
What would happen if you got coronavirus?
I would probably die. What if somebody in my family, or if I do contract it, I'm the only breadwinner in my family, so there's a whole source of income wiped out. I don't know, it's like stepping on eggshells every day.
Y yo pienso que, verdad, deberían de reconocernos un poquito más, porque estamos exponiendo nuestras familias, viniendo a trabajar. Y los beneficios, la verdad, que deberían de ser un poco mejor.
I think my community wants me to stay here in the community too. They've rallied with me and they've written letters for me. And I think this is the town I grew up in. And I think my community is behind me for wanting me to stay here too.
On behalf of all home care workers, to Governor Cuomo, we need your help. We need you to look at us. We need you to work with us and hear our cry.
So that film always makes me feel emotional, even though I've seen it a million times, because I know personally all the people in that film, and I know how much they struggle, and that their stories are representative not only of, millions of people in New York, but also all over the world. And so, the New York Caring Majority is a movement of people with disabilities, older adults, family caregivers, and home care workers who are working to address the home care crisis in New York. And we, I think, very similar to you all, are dealing with a situation where our population is aging, and demand for home care is increasing. And we don't have there is not a workforce to fulfill the demand for home care, because these are some of the most undervalued jobs, and least respected by our system. Home care workers on average in New York are making about $12.50 an hour. They're making $2.50 less than fast food workers. They do not have any benefits. We don't have, socialized medicine or single payer health care. Many home care workers do not get health care. They don't get paid sick time. The vast majority are not unionized. And so, there's a lot that needs to be addressed to value this workforce. We have launched a campaign called Fair Pay for Home Care, which is a campaign to increase home care worker wages to 150% of the highest regional minimum wage in every part of the state. So that would bring home care wages to $22.50 an hour, since the highest minimum wage in New York is $15 an hour. So, and I think that connects to just, home care work is not minimum wage job. It's like very demanding, and requires a ton of skills. It's really hard work. And so our system has to catch up with the reality of that.
Couldn't agree with you more there, Julia. And I think that video was incredibly powerful. Something that stood out to me was that real voice that you bring together, that joint voice of those receiving care and those providing care. And I think that is a real lesson in how to campaign and organise on this. And as trade unionists, we know that getting that union density in the workforce is really important. Phil, you mentioned earlier about the NHS and the People's Plan, a heavily unionised sector, and you see the results in the pay, the terms and conditions that those in the NHS have. And so organising, I think, is a really, really important tactic that we've got to be looking at more. And Nisreen, I wondered if I could bring you in there, because in Wales, where social care is devolved to the Senedd, we have a tripartite system where the voice of workers is reflected with the trade union voice, as well as providers and government. And I thought maybe it would be really useful to hear a bit more about that work going on.
Yeah, thank you, Sian. And we're always happy to talk about this because the progress we've made in the last 12 months or so is something we're really proud of. So Welsh Government launched a Fair Work Commission about 3 years ago now, and we called for this tripartite structure in social care, partly because, as we've all discussed already, the extremely problematic labour standards in the sector, because there's huge amounts of public funds going into it, but also because it's a newly registered workforce. There are additional requirements now on care workers, as well as the cost of registration. So all those factors made us think that it was the obvious choice for this sort of social partnership arrangement beyond those directly employed in the public sector. It started meeting last September, and it quickly got on with a lot of very exciting work. So looking at that shared vision which the unions have for sectoral collective bargaining, thinking about progression and what that can look like in such a fragmented sector, looking at health and safety. Obviously, launching something like this in a pandemic, health and safety was, I think, top of everybody's list. And also thinking about bits of the workforce that we don't often get that much of an insight to. So roles like personal assistants who are paid through direct payments. Since though we had the elections in May, Welsh Government has committed to paying voluntary living wage. So our work has very much been taken over with how can Welsh Government introduce voluntary living wage when it's not the employer of the majority of care workers in Wales. So it's hugely difficult to think of a mechanism which can really guarantee, and what unions want is for workers to have a right to that voluntary living wage when they don't have any of the direct levers to make that happen. So at the moment, we're thinking about how commissioning can be used, but also how we can link the quality of care to things like pay, to actually, you know, we can't mandate in Wales for a different minimum wage rate for care workers, but if we can link it to the quality of care and to the wider health aims, there is potentially a route there. But from a union point of view, there is that wider challenge of just focusing so much on hourly pay. We are missing out on the majority of terms and conditions that actually have created that huge gap between people directly employed by the public sector, by our NHS and councils, and those not. And therefore, we want to see a lot more done to reduce people's risk of poverty. So things like sick pay, proper maternity pay, and also pension. So at those various different life points, people aren't then at greater risk of poverty because they happen to be employed in the private sector compared to the public sector.
Thank you, Nisreen. And I think those points on workforce and making sure we keep that focus on pay, but also on terms and conditions. And Marianne, I wonder if I could bring you in there, one, to speak about pay, but also the care workforce. We know it's a majority female workforce. BME and migrant workers are overrepresented. There's often employment practices, denial of employment rights. I wondered if you could tell us a little bit too about the makeup of the workforce and how it's entrenching some of those structural inequalities.
Yeah, absolutely. I mean, about 80% of the care workforce are women, disproportionately from Black and minority ethnic groups. Actually, if you look at the impact on the care workforce of COVID, and particularly death rates, it was Black and minority ethnic women were particularly likely to die. Care workers were particularly likely to die in the last year. We're also seeing now, I mean, massive staff shortages for a combination of different reasons: low pay, the result of Brexit, in particular, European EU care workers returning to their home countries because of, you know, the way they've been made to feel welcome or not welcome, frankly. I think the issue of pay is a really, really critical one. If you look at some of the Nordic countries, the average rate of pay for a care worker is about 3/4 of the average rate of pay of a nurse. And we've been doing we're currently just about to publish a report with the New Economics Foundation where we're doing some modelling of, okay, what would it actually cost to have a system of care that was free at the point of use, where care workers were paid first in line with the real living wage, and then secondly at Nordic levels of pay. And that isn't cheap. I mean, I think we have to be honest about that. We can't get a good care system on the cheap. But it is actually important to see this not just in terms of the benefits of people in the care sector, the people who need care and the people who are working in the sector, but actually in terms of the economic benefits as we come out of COVID. You know, the government sees care over here as something that you can deal with tiny amounts of money. And then their proposals for post-COVID recovery are all focused on other parts of the economy. So thinking about construction, the whole build argument. We did some work last year that showed if you invested in care, you could create 2.7 times as many jobs as the same amount of money invested in construction. That's because care is a very labour intensive sector. Even if you raised the pay of care workers up to the level of the pay of construction workers, you would still create more jobs. So actually, we should be seeing care both as, you know, most fundamentally in terms of the people who need it and ensuring that people are able to live with dignity and autonomy and control over their own lives, but also as something that is actually good for the economy, is something that's a way of creating jobs and a way of boosting the recovery.
And on that, Phil, I know that we're expecting a social care white paper later in the year. Is there anything you anticipate being in it? What would we want to see in it?
Yes, well, obviously the conversation so far has primarily and rightly been about the way that the money in the system that's been announced is, well, it's not only an NHS levy, it's an NHS levy that punishes the care system, which is just ludicrous. I mean, as people have said, the NHS relies on the care system to keep people out of going into hospital unnecessarily. And here we are doing the wrong thing. But anyway, I mean, the LGA said yesterday we could have a situation where the care sector is worse off. And I think we need to really now watch this. I'd like to see every organisation looking at the impact on its own, every care provider looking at the impact on its staff and on its budgets, because I think if we have some evidence that really does show that to be the case, then they have to change that. But moving forward, I think that's right, Sian, there is going to be a white paper promise in later this year. We'll see whether it actually happens before Christmas, but that's the idea. Now, clearly, they should have done the white paper on reform of the social care system before they decided the money that would be needed to deliver that reform. But we're getting used to the sort of back to front way that all of this goes through Parliament. And indeed, there's a health bill going through Parliament at the moment. In the middle of a health bill, or rather a health and care bill, they're about to publish a care white paper. I mean, none of this makes sense. I mean, when I was a minister, we wouldn't have thought about doing this in such a crazy way. But anyway, is this as an opportunity, is your question? If there is going to be an adult social care white paper, what do we want it to do? And I'm very attracted. This is something Christina and I have talked about a lot through the Future Social Care Coalition, is we lead that reform of social care through the workforce reform. In other words, if we do it right by the workforce, other things then flow from that in terms of integration of health and social care staff in linked career structures, in terms of obviously of pay, thinking about personal assistants and other people that are outside the conventional form of a care worker, and the unpaid carers too, that the whole system relies on a whole workforce that is unpaid and does, husbands looking after wives and vice versa and so on, right across the country all of the time, people looking after their children, all of which gets completely unrecognised really in the system. So this is an opportunity, maybe, to start with that workforce and who the people are and how we improve that, could then perhaps provide a platform for changing the way that this care levy is raised and then delivered. And instead of 112,000 plus vacancies in the care system and a 30% turnover, which how can you have a good care system with those kind of numbers affecting it? Maybe we could then set targets for a social care people plan that really talks about filling those vacancies with well-paid, properly recognised for their skills and the contribution they make, reduce that turnover and see proper integration between the health and care system. Just a final point, there are 42 of these new integrated care systems around the country. The NHS is being reorganised through Parliament as we speak. Those local people in those local areas know all too well that you need to support the care workforce as well as the health workforce. And I wonder whether there's other things that we could be doing collectively around each of those 42 integrated care systems to get those system leaders at local level to really bring the needs of the care workforce and solutions to those needs brought forward while we're waiting for government to get it right, hopefully in the future.
Thank you, Phil. And I think that really helps us to be thinking about that, the quality of the terms and conditions that the workforce are experiencing impacts that quality of care, because as you rightly pointed out, we have that high turnover. And as we flagged earlier, organising in that sector, having union density, I can see that we've got a question about why the lack of parity for care workers with those on NHS not covered by Agenda for Change. Christina, I wonder if we could come to you and think a little about that collective sectoral bargaining and what that might do for social care and how we could begin to get there so that we do achieve that parity with the NHS.
Yeah, so I noticed there's another question in as well from several points put in by Brian Fisher from the National Care Support and Independent Living Service, and he's asked a question about, here are the asks that they've got, and I have to say, if Brian's listening, they're almost identical to the ask that we've got in the Future Social Care Coalition and also within Unison, which is this, it should be free at the point of use, it should be publicly provided. I mean, we're miles away from that at this point in time, and so there probably will have to be steps to get to it. I can't imagine this government turning around and giving us that on a plate. But in terms of where we go on sectoral bargaining, part of what we've been saying around the asks for the workforce has been, and Phil's gone through it, so I won't repeat everything he said, but it kind of links with things that certainly that Julia said in her in her video, is we don't value the skills that are brought to this, and there is this kind of feeling, I think, out there that a care worker is a care worker is a care worker, and there are no gradations between them. And actually, people do incredibly skilled jobs, and they range considerably between, somebody who's just joined a new recruit into the care sector and the kind of jobs and tasks they might be given, right up to people who are looking after and helping people with very severe conditions who need really detailed interventions and up close and personal work with them. And so part of the understanding has to be that this is not just, let's just uprate to the real living wage and put everybody on £9.50 an hour and somehow that will solve all the problems. That is nowhere near good enough. There has to be a proper recognition of the full range of skills and jobs that people do. And I noticed someone mentioned Agenda for Change, just as an example to go alongside it. And apologies for lots of people who don't know this and are not part of the sort of negotiations in it. But the NHS has got 4 grades below nursing grades for healthcare assistants. So that's what we call band 1 to band 4 healthcare assistants. That's up to, so they're for the staff who are not registered qualified nurses, if you like, because that starts at band 5. And that is just precisely to recognise that there are different skills and different levels of responsibilities within those jobs. And that's what there needs to be recognition of within the care sector. Trying to get some kind of sectoral bargaining, I think, is definitely worth doing. We've got lots of support from care providers and commissioners on trying to move in that direction. Again, under this government, I think it would absolutely probably have to be voluntary, which always annoys me because the government can make things happen when they want to, and you just have to look at the compulsory vaccinations. I know this because whenever I speak to government ministers on this, and I do, they always say, but we're not the employers, Christina. We don't have levers to pull. We can't make this happen. Well, actually, they can. The government, of course, they can. And the very first sector where they're introducing compulsory vaccines is the care sector. So if you can make it happen for that, you can make pay happen in the sector, you can make better conditions happen. Even just on things like during the pandemic, sorry, Shan, I'm kind of going on a bit, that's not what you asked specifically. Even when you think of what happened during the pandemic, the government set up the Infection Control Fund, which we had pushed them really hard to put money into something that could help care workers and care providers in dealing with COVID. And we specifically asked them to include in the criteria that it could be used for, that you would pay staff when they were off sick in COVID-related illnesses. And it's still only about 2/3 of providers used it for that. At least 1/3, and I think probably more from the information we got back from our members, at least 1/3 still did not use the money that they got from the government that could have allowed them to pay staff full pay when they were off sick with COVID-related payments, didn't use it for that. Now that's shocking. And the government should have made that mandatory. They should have said, absolutely, during this pandemic, you will pay staff if they're off sick with COVID-related illnesses, because that was a driver of infection that was pushing rates up, and it was leading to the kind of death rates that Mary-Anne talked about, where care workers were dying of roughly about twice the rate they should have, taken everything else into account, all the other demographics into account. And that's something that can't be forgotten, and we have to continually raise this with the government. A long-way-rounded answer of saying, absolutely, Shan, a sectoral bargaining in this group would be is something we are pushing very hard for. And if that means, and that's partly why we did the Future Social Care Coalition on a cross-party, broad-based approach, because we can't do this alone. We need the providers, we need the commissioners, and I think at some point we need the government to be committed to this.
I think that's a really, that's segued really nicely, actually, Christina, as that point. And you were talking about change is possible and we can achieve change. And Julia, I wonder there, that idea, Christina and Phil, that you're working with the Future for Social Care Coalition, that coalition of voices, everybody with an investment in this issue. And Julia, I just wonder if you could tell us a little bit about the experience of bringing together those care workers and those care recipients, and how that has led to such a successful, effective campaign with the regional government, the federal government that you're dealing with?
Sure. And, you know, we're still working on it. We've made a lot of momentum. But I think that, you know, having, you know, basically everyone who's impacted by the home care crisis, we call it the home care crisis. It sounds like it's so referred to as social care by folks in your region. By having everybody impacted by the home care crisis, like at the table, it is such a broad group of people. Basically, I can approach like anyone on the street and ask them if they've had, you know, any experience with like taking care of a loved one or needing care themselves or working as a care worker, and they'll be like, oh yeah, or knowing someone, right? And so it is a broadly, deeply, widely felt issue. And we show that PSA at our lobby visits with legislators, and sometimes they end up crying and sharing their own story of how they took care of, you know, their mom or their aunt, or, you know, or that they broke their leg and needed home care, right? So it's something that's so resonant that, you know, I think the other piece of this is that it is so, in our system, we have like basically two parties. It is so bipartisan. It is an issue that, you know, I mean, I was surprised, like we have some of the most conservative members of our state legislature fighting for this with us. And I think that is powerful as well, that this is a real unifier. It's something that there is no party tied to this, right? This is something that really transcends, you know, party lines. And yeah, I mean, but I think that we still have our challenges. We are up against a large lobby from the nursing home sector that, you know, is not exactly excited about people staying in their homes. We're up against a real estate lobby that would prefer that people get displaced from their homes. You know, those are the forces that have come out against investment in home care in other efforts in other states that have gotten momentum. And so we have no illusions about how challenging our fight is, and how massive our movement is going to need to be, and how loud we're going to need to be in order to win. You know, we are planning to do some more escalated direct action around fair pay for home care, to really put more pressure around this issue in the coming months as our state puts its budget together. And yeah, right now we have a new governor. And so I don't know if anybody's following the scandal in New York, but that now we have the first woman governor has, you know, stepped in, and that potentially opens some new doors as well. So we are very hopeful and optimistic that we can, you know, make massive changes in our home care system, and win these raises for home care workers that are long overdue, because of all of these factors, and because we have a deep bench of like amazing leaders who are working all over the state.
Phil, did you want to come in there?
Yeah. Yes, I'm just listening to Julia. What I really good luck with your campaign. I hope you are successful. But here, interestingly, there is complete consensus about where we need to go between the residential care sector, your nursing home sector, and the domiciliary care sector, providing care in people's own homes. There's even consensus, but on the ground with NHS professionals and care workers and care worker organisations and NHS organisations, we haven't got those kind of challenges. The coalition has clearly has got the support across the board, from local government to the NHS to the voluntary sector, the private sector, employers, employees, the voice of patients themselves, those who need and use care and support in all the different forms that we have it. That's we had an incredible rally in the summer this year where all of those people were present and contributed. We had an amazing petition signed by thousands of people to support it. So that our target is government, and our job is to try to persuade all parties, but obviously particularly the Conservative Party, because it's the party of government and Conservative MPs, about the logic and not just the moral fairness, but the economic sense that Mary Ann was talking about earlier, about this investment in this system. And it's almost, and I've been trying to point out the sort of how innumerate raising national insurance as the means to pay for it is, because it simply punishes those people that you're trying to help. So I think we do have an opportunity going forward. And I thought the video presentation, the stories that were there that we heard from America, I think those are the kind of stories we need to have out there, along with the statistics and the number crunching that needs to go on, with good solutions. We've got solutions. It's not like we don't know the answer, but we need to mount a really good campaign to put those stories and those numbers in front of those people that are making decisions in a way that is solving the problem, that matches the concerns that people have got. And I think maybe we do have an opportunity with the white paper coming up to try and target the workforce development, the reform of the workforce, as being the way forward that meets those kinds of challenges. So unlike the challenges you have, Julia, in New York, we do have consensus right across the piece here. Our job, though, is to put that in front of those that are making decisions to say it's okay to do this. Ministers don't need to be scared. The Treasury doesn't have to worry. This does have consensus about where we're going, and it is affordable. And not only affordable, it can, as Mary Ann said, return investment. It can help the economy as it comes out of the pandemic because of the bang for buck that we get if we start to invest in the care workforce. I just wanted to kind of emphasize that our campaign isn't we've got internal kind of coherence here. It's just persuading the policymakers.
I think one of the things Brian, I can see, has asked us about that again, the coalition there with some really clear demands where there is consensus. The National Care Support and Independent Living Service brings together unions, disabled people's organisations, users and carers. And they, as Phil says, there really is quite a consensus here, and they've got 7 demands that Brian's listed for us: publicly funded, free at the point of use national care service, publicly provided, not for profit. And I think that's some of those tensions that, Julia, you were touching on: nationally mandated, but designed and delivered locally. And Phil, you were talking earlier about those integrated care systems. What can we do to influence them locally, but within a national framework? Co-produced with service users and democratically accountable. I think that's really important. Where you've got private providers, how are they accountable for where some of that public money is going? Underpinned, as we've all said, by staff whose paying conditions reflect true value and skills, designed to meet the needs of informal carers. And is there a possibility of setting up a task force on independent living? And Nisreen, I wondered if I could bring you in there, because how has that task force for you worked effectively in Wales? And then just to get other speakers ready as we're starting to wrap up, 1 or 2 key take homes that you think that we want to see change in social care. What 1 or 2 things coming out of today, lessons we can learn, actions we can take? But Nisreen, kind of just a reflection from you on whether that tripartite system is really managing to make that effective change and that move towards some kind of national task force, the benefit that might bring.
Yeah, so I think to pick up on what Phil said, it very quickly illustrated to policymakers how much agreement there is between unions and, in our case, private sector, third sector employers. That issue around pay and retention and recruitment matters obviously hugely to us, and particularly the impact it's having on members within the sector. The recruitment crisis is really, really pinching now. But also, you know, the first thing employers were saying to government was, we need more money to pay workers more, because they were losing them, particularly to supermarkets at the time. So I think the consensus is hugely, hugely important to making change happen swiftly here. But I think it also allows us to recognise where you aren't going to see that budge from the other side, from employers, particularly around things like security. And that's where you need government to act. You need government to do everything within its power to make sure that you're not just achieving better hourly pay at the cost of other things, whether that's security, whether that's sick pay, anything like that. There is so, you know, it's so complex. It's such a deeply difficult system to get into, and it's so hard for care workers to recognise whether they're getting all their rights. You need government to be as prescriptive as possible in this case. So I think just having that arrangement is going to make all the difference to how something like this voluntary living wage commitment is rolled out, but also put us in a much stronger place as a union side to lobby for the changes we need to happen very, very quickly after that.
Brilliant. So consensus as an effective way to really get governments take action on insecurity pay and all other measures. Mary-Ann, is there any quick takeaway, last reflection from you?
I think really back to the first point that I made, that when we're talking about the care system, we've often got hung up on this how do we pay for it question, and people tie themselves in knots about different taxation systems, which you do need to think about. We actually need to start with what is our care system for? What do we want from a care system? We want a system that allows people to live with dignity and autonomy and choice and control over their lives, and safety. And that requires staff who are well trained and secure and properly paid, where you don't have the high staff turnover and so on. And that has to be our starting point. And that does require more money, but it also requires a reform of the way that care is currently delivered. And I mean, that's probably a whole separate meeting in itself.
Yeah, and one that I hope we can definitely bring back. Chika, the care worker who is meant to join us today, and Gemma, a care recipient, so that we can make sure those voices are here too. Phil or Christina, any last kind of takeaway points from either of you, and then I'll come to you, Julia.
Well, from me, I would say we need more money in the care system now, not in 3 months' time or 6 months' time or a year's time or backloaded on a 3-year programme. We know the system is falling over as we speak. I think Boris Johnson described it as a broken system, and he's right, and it's his job to fix it, and money in the system now. My second one would be the care levy. I would shift this now from a national insurance-based system to a tax, dividends or unearned income tax system. Have a care levy, but just shift the balance from national insurance, i.e. taxing people who are providing care, into people who have got unearned income from the wealth that's accumulating in their house values. And lastly, creating a people plan, a social care people plan at the heart of the white paper on reform of the adult social care system.
Can I just I'd echo what Phil said. That there has to be a people plan, workforce strategy. That has to be the centre of what we do going forward. For me, I suppose one of the extra things is we cannot let up on this. We all had high hopes that following the pandemic there would be something coming from government, there would be some commitment. And actually, I think what we saw this week was just so hugely disappointing. And so we can't give up on this. There's still a huge campaign, lots of work for us to do to keep pressure on the Westminster government and indeed across the UK. So it's not just the Westminster government, but across the UK, to make sure that actually there is still a commitment to do something that makes a difference to the lives of the people who use care systems and the staff who work in them.
I think that notion of solidarity and change across the UK extends beautifully, Julia, to I'll give the final thought to you, because that solidarity, this issue goes across countries, it goes across the world. And just a final kind of thought reflection from you, maybe about what we can do to join together the campaigning work that you're doing, join it together with the work that we're doing here to really create a care-led recovery, as Marianne, the Women's Budget Group, have called it, but across the globe.
Definitely. I mean, I think that we all have so much to learn from each other, and you know, being able to build these relationships and share best practices and what's working and what's not working across countries is really valuable. And I think the world is ready for the message that we have. You know, our President Biden, he came out saying care is infrastructure. That's the first time, I think, in our country's history that we've had a president say care is infrastructure. It should be counted as infrastructure and included as just as important as bridges and roads and tunnels. And so I think that, you know, there's so much potential and room and space for this issue and for us to actually make a huge impact across the globe. So that's my hopeful message.
Brilliant. Well, it's 1 o'clock. I need to bring this to a close. I want to thank you all speakers again. Thank you so much for joining us today. This certainly won't be the last of it. We need to be, as you were flagging, Phil, we need to be working together ahead of that social care white paper. What do we want to see in it? We've got the brilliant work that Unison, Women's Budget Group, Wales TUC and others, the Future of Social Care, the Future for Social Care Coalition have already been doing. Now it's about putting those ideas together, those with Brian that you mentioned earlier, making sure we are a united voice that cannot be ignored. Thank you too to Liz and Hayley, our interpreters, and to Debbie, our captioner. Thank you to all of those who asked questions and gave us comments. We will keep thinking those over, responding to them, reflecting them in the work that each of us are doing. Thank you everybody for joining us this morning. I hope to see you all soon with some really good news about where we're getting on social care reform. Thank you, everyone.
Thank you.
Thank you.